Jackson was born April 8th, and he actually did very well. And then about 14 hours in, one of the nurses walked in and noticed his color was a little bit off. She said he appeared a little bit blue and purplish, so she rushed him down to the NICU. We were offered to go to Jacksonville, or we were offered to take Jackson to UF Health to get his treatment, and we heard that UF Health had one of the best reputations.
So Jackson was transferred here as a one-day-old with newly diagnosed congenital heart disease. He wasn't diagnosed prenatally.
Jackson's pulmonary valve is very small, that it limits the blood flow to the lungs, that it's almost blocked, and he will eventually die if he doesn't get this fixed.
Jackson required surgery.
Ultimately, his best option was the open heart surgery.
And we were able to open up the valve and also provide extra blood flow to the lungs. And so now Jackson will be followed as an outpatient. We can do really great things in the hospital. We can take really great care of these kids and their families. But then we have to send them home, and they have to feel very comfortable knowing that their babies are safe.
These are the oxygen levels. This is what's very important for us because he has the shunt, so we want to know what his oxygen levels are.
And so we really have a wonderful new innovation and new technology to follow these children as outpatients. So parents will go home with an iPad, which will directly connect them with our team of cardiologists who follow these very special children.
The information that the parents will enter in the iPad app will tell us in real time if the patient will need attention, if the patient is getting into trouble, way ahead of any symptoms that he's probably going to have.
This app actually gives us a lot of extra peace of mind because when we put in a stat and it comes back in a range that they don't want to see, it actually alerts you, comes up with a message to either redo the stat or to call and make a phone call to UF Health and go from there and try and figure out if we need to come down here immediately or if we need to see our cardiologist in Tallahassee.
This iPad technology is wonderful because it actually gives us an opportunity to actually go home with them. We feel like we're literally part of the family.